Informed consent is a legal right that exists in all 50 states. As its name implies, informed consent requires that a medical provider tell the patient in an understandable way all information that is important to an intelligent decision by the patient as to whether she wants to agree to the treatment. What does this mean to you, the patient? Simply stated, you can only give an informed consent to treatment if you fully understand all of your options, risks, and benefits and have all of your questions answered before making your decision. It is important to realize that informed consent is not just a signature on a form, but a process of communication between you and your medical provider about risks, benefits, alternatives, as well as the severity, major risks of injury and/or death, and the chances of those risks and benefits happening in a patient like you. The informed consent document just shows that the communication has occurred. The document is not a substitute for the conversation with your provider. What, as a practical matter, does this mean? As the patient, your having a say in your healthcare choices is an essential ingredient to becoming part of the treatment team. There should be no decision about your body or what is done to your body without your active, intelligent, and informed agreement in your decision. You, as a patient, have the right to have your questions answered. You will probably want to know, what are the risks of the proposed treatment for patients like me? What is the chance of those risks occurring? How many procedures like this have you and your team performed, and what are the complication rates? If there are risks, what are the chances of complications in a patient like me? Are they severe? And if so, what are the chances of death or disability? You may also want to ask, what benefits are likely in patients like me? Are there alternatives to this procedure that have the same benefits but are less risky? What happens if I decide to do nothing? As the patient, you are entitled to know the answers to these questions so that you have the information needed to actively help in and make an informed judgment about what is best for you. You should share with the provider all relevant personal information that might make one treatment or side effect more or less acceptable. You should understand the trade-offs between different treatment options so that you can tell your provider what is most important to you. If you are not sure of the trade-offs, you should ask your provider to explain them more clearly to you. Your medical provider does not know what your values and preferences are unless you tell him or her directly. Working together and sharing information about your preferences with your provider is a winning solution to all medical care treatment decisions and is called shared decision-making. Ask questions and seek answers the shared decision-making way. It is the most important thing a patient can do.